My name is Dillon. This is a supportive technique for spraying of the collateral ligament of the finger. So first you're going to start by placing an anchor over the distal interphalangeal joint, like so. This is after you went through all your different contraindications. Then you're going to go to the proximal interphalangeal joint. Make sure they're not too tight. It's good. So now you're going to want to make an X over the ligaments through these joints. So starting distal, diagonal over the joint, like so. Then the second portion of your X, like so. Then you're going to want to support the other side as well, so you get the patient to rotate their hand. Once again, making your X's, the joint, and another one. So now I'm going to get my patient to flex and extend to see how that feels before closing it up. Feel good? All right, so we'll do a quick cap refill. Less than 2 seconds is good. Close up here. And then grab our roll. The final closing. And then check the refill once more. Good to go? Feel good?
It was great.